Hello, everyone. Today we are here to spotlight Dr. Trisha Schimek, one of the co-authors in the book, How Healers Heal. Hi, Trisha. Can you introduce yourself?
Yeah, hi Shelby. Thank you so much for having me. My name's Trisha Schimek. I'm a physician that lives out in California. I'm board certified in family medicine and lifestyle medicine. Currently, I am working at a county safety net hospital in family medicine. So I work with a very underserved population, and I'm also part of a family medicine residency faculty. So that kind of fills my cup that I get to teach and inspire. It's what kind of drew me here after I finished my global health fellowship.
You are so passionate. I love hearing your story and reading your chapter. Can you tell us a little bit more about how you got introduced to lifestyle medicine?
Yeah, I think it's always been in me, but I was like introduced to lifestyle medicine. Um, Actually, when I was doing the AFP fellowship in well-being and leadership, and there some of our faculty had been certified in lifestyle medicine and were, part of our lectures. And I was just really drawn to it. I think it's because it's like, you know, hit home with like my values. So that was where I was like tipped off to that this certification even existed. But I think I'd been, doing some of this practice like with my patients for a long time. And I think I was drawn to it especially because I had done a lot of global health and public health. And so with those, we think about big picture, right? Like we're thinking about the like social determinants of health. And we know, that poverty, like our financial well-being, where we grow up, like what we eat, all of that affects our health. But I think I was kind of getting like stressed in the clinic visit because like having that knowledge and knowing that, um, but you're like dealing with the individual who is sitting in front of you. And so like lifestyle medicine kind of brought in that like behavior change component and allowed me to like see the individual in front of me, know about all of these like social determinants that are going on, but then how do I help this individual achieve their like best health?
I love that. So you're taking so many layers of medicine. You're going from the individual level to probably family and community and state and global. That's amazing. And lifestyle medicine does have that focus of kind of overall healthcare change, which I love. You have any more thoughts about how you're incorporating overall globalization, which I don't think I've explored that with any other author yet. Go ahead.
Oh, how um, I think just knowing about that brings in a different perspective. Uh, so I'll give you an example of like thinking about like right now, we know that like access to food, right? Like when we're talking about food insecurity, has a like a detrimental effect on health, right? Like if you're not even able to afford or know where to buy like healthy foods, how on earth are you gonna like be able to like meet those nutritional needs? And so right now, like where I am in California, there's like this effort that we're like prescribing food. And it feels so good as a physician to prescribe food. It's the project's a CalAIM project, and I get to like write a prescription, and like food is delivered either as like prepared groceries or prepared meals or groceries to our patients, and it feels so good to be able to prescribe food.
That is so neat. I've never heard of that. That's wow. If anybody could incorporate like prescribing food, prescribing healthy food.
Yes. Yeah, and actually it's been fun. So one of my colleagues who's been doing this work a lot longer than I have. She like invited me to like start like sampling some of the food that we are prescribing, right? Because we want to make sure that not only are we not just sending any old food, that the food that we are sending kind of follows the guidelines that we want to follow, and that we want to follow like a whole food plant-based diet. So it's been really fun having food delivered here and like tasting the samples and like knowing our patients, right? Like, is this something that they're going to be excited about and want to participate in?
That's so cool. I hope other health systems kind of incorporate this prescribing food model. Your California has always been kind of a leader in a lot of things, so this will be one too. And I just thought of it after I asked you the question. The global reach of lifestyle medicine from you is also impacted by just your sharing your story in this book, because this book is going to be distributed, hopefully worldwide. I think it's such a beautiful book about physician stories and your story. I don't
I
want to
hope
get
so
into
too.
too much detail because I don't want to give away your chapter, but can you give them a little taste of what is in your chapter?
I mean, I certainly talked about food because I have a passion about food and love to talk about that. But I think when I was reflecting and actually writing the chapter, something that stood out, like one of the pillars of lifestyle medicine is stress management. And I didn't realize how much I had let like the daily stressors kind of like turn into chronic stress. And I wasn't actually like really willing to admit that I was having chronic stress, because I see chronic stress in my patients, and like I think um, that's reasonable, right? Like they have a lot going on, and but I think us as like physicians, like especially during the COVID pandemic, but even before, right? We know that like physician burnout is like was rising. I mean, even the U.S. General Surgeon, Dr. Murthy, had like declared that this is like a public health emergency, that we need to put physician burnout at like a top priority. But that being said, like I didn't want to admit that I was stressed, because like as physicians, we work hard. If something's not going right, we work harder, and having to actually slow down. And so thankfully I had two kids, and that kind of taught me that I had to slow down. Like finally, when you have another little like person's needs who depend on you, um, really taught me a lot. And it was like during like my maternity leave of like learning how to like slow down. And I think in the book I mentioned like nursing was definitely a time that you can't really do anything else. Like I tried to like, be texting and talking and like reading. But there were times that I'm like, no, this is a moment to just like be present and treasure and like and be with my kids.
I can't follow up to those true words with anything other than I know lifestyle medicine you feel is a one of the cures, or maybe not cure, but a path to controlling burnout. Why else
Yes.
should someone read this book? I mean, I think all of our stories are all a lot about burnout. Why else should a physician or a patient read this book?
Well, I think so. I'll start with physician. Um, I think a physician, because I do think that lifestyle medicine is a great antidote to our burnout, right? Like if we have an opportunity as like an individual to like look at our six pillars and kind of just gauge, we don't have to judge. We just kind of like gauge where we're at on those pillars, that can um, kind of tell us where we are on our like health journey. And I realized for me, like that stress management was where I needed to like focus in, because I was like good at eating healthy. I liked to eat that healthy. I was good at like physical activity, and I'm a socially like connected person generally. But like the stress management. And so I think if physicians read this, hopefully, like I would love to inspire other people to take care of themselves, and to like break that culture that taking care of ourselves doesn't mean that we're not taking care of a patient. Like taking care of ourselves means that we're able to then show up and take really good care of our patients. Like our patients deserve like critically thinking doctors that are present with them in the exam room. And I think when we let stress go, we're not present anymore. And it's a hard thing because we don't feel like we're healing. And then I guess for patients, I hope that patients can get a lot out of this too, because I think we're all human beings, right? Like, yes, we're physicians, and yes, we have a lot of knowledge about like, the biological, the human being and disease, but we're human beings and we've had to like go through some of this too. And so I think that wisdom is like universal.
I love that. What is your number one takeaway for, I guess, two-part question? I keep giving you two-part questions. Number one, for stress management, and number two, like for individuals looking to make a change in their life.
Yeah. So for the individual making a change, I love the quote, what is it? And like an ounce of prevention is worth a pound of cure. Um, because sometimes I think we don't feel like the little changes that we're doing every day, like, oh, if I do wake up at my 5 o'clock alarm to go to my workout, like, is that really going to matter? But if we do that over and over and over again, all of that adds up, and it is all worth it. And so if we can keep making those positive small changes every day, it like moves the needle tremendously. Um, and so like I see what happens with my patients sometimes is they'll give up because they didn't do all of it. But if they do a couple of those things, it adds up. And what was your first question?
Stress management, your number one takeaway to how you've been able to manage stress or other people.
Yeah. So the two ways that I've like incorporated in the past 2 years for stress management that have kind of been life changing has been journaling and gratitude. And actually, I decided to do this chapter because I always thought of myself as not a writer. So I was like, oh, this is gonna like kind of break that like self-limiting belief or paradigm I had, and be like, no, I can write. But because I've been journaling, and that has been like a great way to put all of these thoughts that we have in our head on paper, and it just kind of like puts yourself away from those thoughts. And I think that's part of what mindfulness is, right? It's like we have, I don't know, thousands and thousands of thoughts a day, and if we can kind of remove ourselves a little bit from all of those thoughts that are going on, and just be present and like enjoy the moment, um, it's a beautiful, beautiful thing.
I agree. And just that little mindset shift of gratitude of instead of, oh, I have to do this or I have to do that,
I
like
get
get to
to.
do this. It's
Yes.
so powerful and it just changes your whole attitude towards whatever you're doing. I love that.
Hmm.
Is there
Yeah, I
anything?
get to work out.
Yes, I get to work out. I get to pick up my kids' clothes off of the floor some days
Yeah.
because I have kids and they're just so adorable.
Yes.
Um,
Yes.
is there anything else you want to share about participating in this book or how people can reach you or anything else?
Oh. Well, I mean, I first want to extend gratitude to you. I am like so thankful for your like determination. Like leading 33 leaders is not an easy task. So thank you for like your persistence, and I hope that we can like help and like promote this, because I do think that like you know all of us can change the world, right? Um, and what was the other question? Or what was the
Anything else you wanted to share or leave for patients or people or physicians, struggling or how to reach you? Anything else you want to share before we wrap up?
Oh, well, don't give up. Change is just like one change away. And yeah, I am a fairly early career physician, so I'm like, starting to be more visible. And I would love, speaking opportunities, but I guess the um, below is like my LinkedIn profile, so you can find me that way. I will have a website coming soon, so um, yeah, I'd love to connect with anyone interested.
Thank you so much, Trisha. You are a joy and wonderful, just sunshine everywhere. Thank you. Thank you.
Thank you so much. Take care.
Bye.